Today we will discuss cellulitis, but really quickly. Are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, pharmacist, seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine in layman's terms. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible. Cellulitis is a bacterial skin infection that affects the deeper layers of the skin and the tissues beneath it. It usually occurs when bacteria enter through a break in the skin, such as a cut, scrape, or insect bite. Symptoms of cellulitis: redness and swelling. The affected area may look red and swollen. Warmth. The skin may feel warm to the touch. Pain. There can be tenderness and pain in the area. Fever. You might have a fever or chills if the infection is more severe. Blisters or pus. In some cases, blisters or pus may develop. How to know if you have cellulitis. Check for symptoms. If you notice redness, swelling, warmth, and pain in a specific area of your skin, it could be cellulitis. Look for breaks in the skin. Consider if you've had any recent cuts, scrapes, or insect bites in that area. Monitor for fever. A fever can indicate that the infection is spreading. When to see a doctor. If you suspect you have cellulitis, especially if the symptoms are severe or worsening, it's important to see a doctor. They can prescribe antibiotics to treat the infection. If someone has cellulitis, here's what to do in simple steps. See a doctor. Get medical help as soon as possible. Take antibiotics. If prescribed by a doctor, make sure to take the full course of antibiotics. Rest. Encourage the person to rest and avoid using the affected area. Elevate the area. If possible, keep the affected limb elevated to reduce swelling. Apply a cool compress. Use a clean, cool cloth on the area to help with pain and swelling. Watch for changes. Keep an eye on the symptoms. If they get worse, return to the doctor. Always follow the doctor's advice for the best recovery. In the hospital, here's what doctors do to treat someone with cellulitis. IV antibiotics. They give strong antibiotics through an IV to fight the infection quickly. Monitor symptoms. Nurses check vital signs like temperature and heart rate to monitor progress. Fluids. They may provide fluids through an IV to keep the person hydrated. Pain relief. Doctors may give medication to help manage pain. Wound care. If there is an open wound, they can clean and dress it properly. Surgery, if needed. In severe cases, they might need to drain any abscess or infected area. The goal is to reduce infection, relieve symptoms, and help the person recover. Here are some commonly used antibiotics for treating cellulitis. Cephalexin, Keflex, a common oral antibiotic used for mild to moderate cases. Dicloxacillin, another oral antibiotic effective against certain bacteria. Clindamycin, often used for those allergic to penicillin or for more severe infections. Amoxicillin, sometimes prescribed for mild cases, especially if strep bacteria is suspected. Vancomycin, a strong IV antibiotic used for severe cases or when resistant bacteria are suspected. Always follow a doctor's guide on which medication is appropriate for the specific case. People at an increased risk of developing cellulitis include diabetics. Those with diabetes may have a weaker immune system and have more skin issues. Obese individuals. Extra weight can lead to skin folds where bacteria can grow. People with skin injuries. Cuts, scrapes, or insect bites can make it easier for bacteria to enter. Those with poor circulation. Conditions that affect blood flow can increase risk. People with weakened immune system. Anyone with a weakened immune system due to illness or medications is more vulnerable. Active athletes, those who play sports may have more skin injuries or contact with bacteria. These factors can increase the chances of getting cellulitis. Now you need to watch my video on Staph aureus or have a look at pneumonia.